We appreciate you being here today, where we are joined by physicians across North Carolina's 11th Congressional District who will be sharing what the newly chosen Republican candidate Jennifer Balkcom's track record could mean for healthcare in the region. Before we begin, I'd like to note that these physicians are speaking today as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves and do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Um, without further ado, then, I will introduce our first speaker, Dr. Helfman.
Good morning. My name is Dr. Laura Helfman. I live in Marshall. I have worked throughout Western North Carolina in most of the emergency departments in the Western North Carolina region, as well as up in Tennessee at the medical center in Johnson City. I work primarily now as a pediatric emergency physician, but I have worked in adult medicine for a good bit of my career as well, which has spanned almost 40 years at this point. I'm joined by other physicians in the 11th Congressional District because we're very concerned about what State Representative Jennifer Balkcom's track record on healthcare might mean for our region and for our patients. Now that she is the Republican candidate running to represent us in Congress, we feel that the citizens of Western North Carolina, our neighbors and our friends, need to know about her positions on healthcare because they concern us. 3 years ago, our state expanded Medicaid under the Affordable Care Act, which was long overdue, but it was a wonderful addition to the health of our state and specifically our region, because there were so many who were uninsured or so underinsured with their other options. This was bipartisan. This was not Democrat or Republican. The entire state legislature came together to help support this effort under the guidance of our governor and other state officials. And this allowed 725,000 more North Carolinians to get coverage. This means that families could no longer have to rely on the ER. They could go to their pediatricians, to their family doctors, to their internists, to their cardiologists, and get regular checkups. They could also get care for pregnancy, prenatal, and postpartum care. All kinds of preventative health services that would lead to less need for services were included, including dental care, which is incredibly important because that impacts all other aspects of health. We were thrilled and, like I said, long overdue, but yet very thrilled that North Carolina joined the majority of other states who had expanded Medicaid under the Obamacare expansion. Jennifer Balkcom said that she opposed that expansion and was one of the legislators who voted against it. Now that she's running for Congress, although she says that she wants to make rural health care more affordable, she opposes Medicaid expansion, which is one of the very important things that made it more affordable and made it more accessible. And I'm not aware of any plans that she has to do that. It's one thing to say you want to make it better, but you need to have a concrete plan in place. Her track record doesn't support that. If we want rural health care to be affordable, patients need to have coverage that's comprehensive, not something with $10,000 and $12,000 and $15,000 deductibles. That's basically no coverage. They need to be able to visit their own physicians, only relying on the emergency department for life-threatening illnesses that can't wait. Relying on the emergency department doesn't give them primary care and allow them to have better health in general. Rural hospitals need to have money in order to operate. And we have seen, not just in North Carolina, but especially in our southern neighbors, Tennessee in particular, significant numbers of rural hospitals have to close because they just don't have the patient base and the reimbursement base to continue, which leads to loss of jobs in the area and further deterioration of healthcare. We need policymakers who understand that Medicaid is part of the equation in doing that, and only a step toward other options. Medicaid is how patients get medications, see their doctors, and get preventative care and urgent care when it's not life-threatening, or at least that's how it should be. If the rural hospitals aren't open, then even urgent care is compromised when patients have to go an hour for care, and that is the case in some places. They depend on the patients to be able to stay locally, and only be transferred when it's a more significant problem that needs a regional center. Expansion brought federal dollars into the state and allowed for the improvement in rural healthcare. But Jennifer Balkcom opposed it. I've seen the difference. I can just give a few examples. One 55-year-old patient of mine with prior heart disease who was unable to get insurance would have to come to the ER anytime he thought there was a problem with his heart. And once you've had heart disease, of course, you're more concerned about that for any little chest pain or whatever you might get. He couldn't see his cardiologist because they wanted some type of payment up front, which he didn't have. He told me one time he already owed the hospital $300,000, our big mission hospital here. He worked for the county, but was employed less than the required minimum to get employer-sponsored health care and could not afford any other options. After expansion, I only saw him when I saw him where he worked, because he now had a doctor and he had coverage and he didn't need to come to the ER for his regular care. Another patient who was also a friend could finally get a hip replacement after expansion, and that allowed her to continue working, which she was getting ready to stop because the pain was so bad. These are the patients I think of when I reflect on Representative Balkcom's opposition to Medicaid expansion. Our current and disgraced representative, Congressman Chuck Edwards, failed us on this as well. He voted for H.R. 1, which made the biggest hospital cuts to Medicaid in the program's history. We have an opportunity to replace him with someone who actually values healthcare. Jennifer Balkcom is not that person. Now I'd like to introduce Dr. Brown.
Good morning. My name is Rachel Brown. I'm a pediatrician and neonatologist in Asheville, North Carolina. I want to talk about another part of Jennifer Balkcom's record that matters to physicians, her position on abortion and the role government should play in medical decisions. In 2023, North Carolina enacted a law prohibiting most abortions after 12 weeks of pregnancy. Then Governor Roy Cooper vetoed that legislation, but the General Assembly voted to override his veto. The law took effect and continues to ban abortion after 12 weeks today. Jennifer Balkcom supported that abortion ban. She voted to override the governor's veto. In fact, she went so far as to say, quote, "Abortion is never medically necessary," end quote. As a physician who works closely with my OBGYN colleagues taking care of pregnant women and critically ill newborns, I couldn't disagree with that statement more. The goal of my career in medicine is to provide newborns with the best chance to go home with their families healthy. That has been my goal. That is my heart. However, there are innumerable instances we encounter in medicine when abortion is the only medical choice available to save the life of the mother. They need to be able to go home healthy to their families too. But even when abortion isn't necessary to save a patient's life, it is still a private medical decision that should be taking place between a patient and their physician, not by politicians like Jennifer Balkcom. I want to be very clear. Abortion is healthcare. Abortion is medically necessary, and abortion saves lives. Something I encounter in my practice frequently are women who come in with premature rupture of membranes. This occurs in about 2 to 3% of pregnancies in the United States. Sometimes this happens and results in preterm delivery, and many of these infants spend considerable time in the NICU. However, this rupture can happen very early in the pregnancy. Sometimes it happens well before the time of viability. In these situations, the lungs will never develop enough to support life outside of the womb and without the placenta. Without a therapeutic abortion, many of these mothers face the risk of infection, hemorrhage, and death. When politicians meddle in reproductive health care, the consequences can be profound. We've seen the consequences of North Carolina's ban, the ban that Jennifer Balkcom voted for. Women being forced to delay their care, they have suffering, and they're putting their health care, their future fertility, and their lives at risk. The so-called exceptions that our state's ban don't provide enough clarity for physicians, leading to confusion and concern about being penalized or even criminalized for practicing medicine. Patients should be able to access life-saving care without political interference. And politicians like Jennifer Balkcom should leave medicine to the experts. Anti-abortion extremists are trying to further chip away at the abortion access at the federal level. So it matters more than ever who we elect to Congress. Jennifer Balkcom has shown herself to be extreme on this issue, and voters should be made aware. Now I'd like to introduce Dr. Pickler.
Good morning, and thank you both, Dr. Brown and Dr. Helfman. My name is Dr. Bruce Pickler. I am a retired podiatrist, living now outside Asheville, North Carolina. And my story takes me back to when I was in practice in Dahlonega, Georgia, just about 4 hours from here. But before I get to that, I would like to say that my colleagues have done a great job so far talking about what happens in Washington has a direct impact on what happens in the examination room. And it makes it very difficult for physicians and nursing staff to take care of patients. When we remove healthcare coverage, and today we're talking about specifically Medicare, the patients have no choice but to postpone healthcare. And this can lead to a whole wide variety of medical problems. And people that are younger don't really appreciate what happens when people do have medical problems. And so as a result, healthcare is postponed and we can have poorer outcomes. One thing that happens more in rural counties, in rural areas, is the small rural hospitals are dramatically impacted by Medicaid cuts. And as a result, patients are not going to get the care that they need. So this is where I would like to go ahead and talk about what happened to my practice in Dahlonega, Georgia. I went on staff there in 2010 at Chestatee Regional Hospital. Beautiful rural hospital, a lot of rural patients. The next closest city was 30 miles away. And when I went on staff there, I noticed that there wasn't an OB department. And they indicated that there used to be, but because of cuts in Medicaid, that they had to cut OB, they had to cut women's health care. And over the years, they gradually began to cut back different services that they provided. And eventually, they ended up cutting back inpatient care, surgical care, and then eventually the hospital closed. And when the hospital closed, that's when I decided to go ahead and retire because I didn't feel like driving 30 miles to an office. So when if Georgia had expanded Medicaid, we would have been able to continue providing health care. I would still be in practice today, but Georgia didn't. And at that time, of course, North Carolina hadn't. Now, Jennifer Balkcom didn't want to expand Medicaid here in North Carolina. And that is such a shame because so many people rely on it. And little by little, the small hospitals are going to be impacted and they're going to cut services. They're going to eventually close. And so unfortunately, a lot of good that Medicaid expansion has done will be wiped out next year by H.R. 1 when it goes into effect. And unfortunately, Congressman Chuck Edwards and now his potential replacement, Jennifer Balkcom, has decided to continue to cut Medicaid. North Carolina officials have warned that hundreds of thousands of expansion enrollees will be at risk of losing their coverage. And we deserve someone in Congress who understands Medicaid, who understands health care and the importance of Medicaid to everybody, but especially the rural communities. Chuck Edwards and Jennifer Balkcom certainly do not understand medical care and how she plans to improve rural health care. She has not made any comments as to what she's going to do, how she's going to improve things. And I hope that all people, North Carolina and throughout the country, see that this is rhetoric and that there's nothing behind those words to make things better. Thank you.
Thank you so much, Dr. Pickler, Dr. Brown, and Dr. Helfman. We'll now open it up for questions for the media. If you have a question for one or all of the physicians, there are a few ways you can go about asking that. You're welcome to type that question in the chat box or the Q&A function, or you can raise your hand and in Zoom, and I can allow you to unmute to ask your question verbally. So we will allow a few moments for folks to be able to type those questions or raise their hands. I had one chatted just to me. I'm going to put it in the box for you all, and I'll read it out. As you mentioned, Jennifer Balkcom says she wants to make rural healthcare more affordable. Based on your experience as a physician, what policies actually make rural healthcare more accessible? That's for any of you.
I'll try to give you some examples of that. Certainly, if someone does not have healthcare insurance, healthcare becomes very unaffordable. I don't know if any of you have looked at an EOB lately, but the cost of healthcare for all of us, whether poor, low wealth, or more privileged, has skyrocketed to unbelievable amounts. So if a person is less well off and they don't have affordable health care, they can't go to the doctor and they can't keep themselves healthy. So in my experience, the policies that make rural healthcare more affordable or accessible is to provide healthcare, income-based healthcare, to help those people who have minimum wage jobs, who are already living in an area that housing is very expensive. We know all other costs are becoming expensive, and where healthcare would consume more than 50 or 75% of their income, which makes it unattainable. And without attainable healthcare, then rural healthcare is just not accessible at all.
Thank you. Thanks for that question. Oh, Dr. Brown. Dr. Brown, did you
Yeah.
want to add?
So I would like to add, the way that I see this is how poor health of mothers affects their newborns or their fetuses. And so when women who are thinking of becoming pregnant or become pregnant and they haven't had access to health care, they have things like chronic hypertension as well as diabetes. And if they are not healthy, their babies are not going to be healthy. This is how we end up with a good number of our babies in the NICU because of maternal poor health. So expanding their ability to get health care prior to becoming pregnant and while being pregnant is really important long-term for those babies, as well as the moms.
Absolutely. Thank you both. There was another question chatted to me. I'll chat for you all. How can abortion restrictions affect patients experiencing miscarriages, pregnancy complications, or other emergencies? That's for any of you. Dr. Brown, do you want to take that one to start?
So when again, I'm not an OBGYN, but I work closely with them. And the way that we see the inability to get abortions affecting these moms is it truly can cause them to have infection and death, certainly. And this kind of all goes together with the ability to have health care. So these women are potentially not having ability to get health care. They're unhealthy. They have things like preeclampsia, which is where they have very high blood pressure in pregnancy. Sometimes this happens very early. This can cause seizures and even death of the mother and the fetus. So sometimes we will encounter women who have preeclampsia that is severe enough that the only way to treat it is delivery. And sometimes that delivery or abortion is going to happen before the time of viability. And so if this is not available, these women cannot be here potentially, but they also may not be able to have future healthy pregnancies, and they may not be able to be there for their families and their children that they already have. So not having this ability to seek abortion care for things like miscarriages puts these women at very high risk for infection, death, and ultimately not being there for their families that they may already have.
Yeah, Dr. Hoffman, go ahead.
So, I mean, Dr. Brown alluded to this in her opening remarks, but there are times when a pregnancy would be so detrimental to the woman's health if she has a condition. I personally have lupus, and pregnancy could have been devastating to my health. And if I had 2 or 3 or 4 other children at home, then this could be threatening to my life and the life of my family. There are times when it is medically necessary to consider a termination. The medical word for miscarriage is abortion. When we note in the medical record the number of pregnancies, live births, and other things that you would call a miscarriage, we call an abortion. That's the medical term. And sometimes for both the health of the mother and others, it is the right decision. But that has always been a controversy. What was never controversial is that if a woman had an ectopic pregnancy, for instance, they should be able to receive the medications that would save her from rupturing her tube and bleeding to death. And now that is greatly at risk because of the abortion restrictions, because doctors are afraid that if they use these medications, they'll be accused of murder when they're just doing what's medically necessary. There are other times, Dr. Brown mentioned, one could get septic. That term has made it into the widestream understanding, which is overwhelming infection of the body, which could lead to death and has led to death in many women throughout the country who needed to have the pregnancy terminated to save their lives. And doctors who knew it was the right thing to do were afraid to, because they were afraid they would either lose their licenses or go to jail. North Carolina is not the most restrictive at this point, but it's pretty close. And we know that the number of abortions in this country has gone up since the rules, because this is a necessary part of healthcare, as Dr. Brown said, and I can't emphasize that enough.
Absolutely. Thank you both. I see one more question so far. I will put it in the chat box again. If you could say one thing directly to voters about the healthcare consequences of this election, what would it be? And that's for any of you again.
Well, I'm still on, so I'll just stay on. The healthcare consequences of this election, should we get a representative who continues to restrict healthcare access in all its forms, will be that a lot of people will die. I can't tell you the exact number, but I know that various organizations, including Committee to Protect and Physicians for National Health Program, know that there are so many hundreds of thousands of deaths per year due to lack of health care. And if Medicaid is more restricted in North Carolina, which it would be with the HR 1, or if if expansion's eliminated, or if hospitals close, then hundreds of thousands of people throughout the country, which means a lot of people in North Carolina, will die unnecessarily, will not get their cancer treatment So they may not die this year, but they'll die in a year or two in a death that wasn't necessary in perhaps a very torturous way. Children will not get their vaccines. Children will not get health care. Their teeth will not get the care they need. There are so many consequences, both in terms of morbidity and mortality, that will occur if the hard-earned expansion of Medicaid and healthcare in general continues to deteriorate. We are here talking about its loss, but we really need more expansion, not any discussions about loss. Those of us who are privileged to have good healthcare know it's a struggle. And again, what Dr. Pelter said, it's when you get older that you start realizing how important having healthcare is. I wouldn't trade my Medicare for anything in the world. It was a big change in my life in terms of my health issues.
I would also like to emphasize that while certainly increased deaths may happen, I think that people need to realize that this system all works together. And so while you may have good health care, other people may not. Remember that with them not having adequate health care, they may be taking up your spot in the emergency room. So when you have a heart attack, you may not get taken care of as quickly because the ER is full or doesn't exist anymore as a rural hospital for you to get your care. So while you may feel like this isn't going to affect you, this affects everyone. And this also affects physicians and other people in healthcare who are suffering high rates of burnout because of the system failing people, as well as the people who work in the system. It is becoming overwhelmed, and this affects everyone. So you may not realize the indirect effects, but they're there and they may get worse.
I would actually add to that in the emergency department specifically, and one of the reasons I switched to pediatrics primarily is that our staff in the emergency department, more than any other department, are leaving at rates that are phenomenal. I've been in this, I started in Haywood County in the 80s, and I have been in this a long time. And generally, the emergency department was a cohesive team of dedicated professionals who got tired at times, but loved what they did and stayed. Nurses stayed 40, 50 years before they retired. And now, because of the stresses specifically of the emergency department due to lack of coverage and due to lack of healthcare support, is a battleground. The Pit is a very good example of that, the TV show. So nurses leave early. They find another position that isn't so stressful. Doctors are not working. I'm alone in my 60s, still doing emergency medicine. And part of the reason I was switched to pediatrics is because it's a little less affected, because most children have some type of health care, whether it's through their parents' employers, whether it's through CHIP, whether it's through Medicaid. There are very few children who have absolutely no coverage. So pediatric emergency departments can still function, but general emergency departments, whether they're big or small, can't function anymore, and they don't have the staff. If all your nurses are coming travelers because full-time staff can't stand it anymore, then the care suffers. And anyone who's been to our beautiful big hospital knows that.
Thank
I
you.
would like to add
Go ahead.
one additional comment, if I may. One of the concerns that I have are the people that are making these decisions, that are writing these bills. They're already in Congress. They have excellent health care provided by the government and by the taxpayers. And I would ask them, what would you do if suddenly you lost all your health care? If you had to pay for everything out of pocket and you had a sick child or you had a sick spouse, how would you afford that? And put yourself in the position of people that do not have the money or the insurance to go to have a good, healthy life. Thank you.
Thank you, Dr. Pickler. Yes, I hope that Jennifer Balkcom will put herself in that position if she is elected. With that, I'm not seeing any other questions, so we'll go ahead and wrap up today's call. If you'd like a copy of the recording, please, you can send it in the chat right now that you would like that, or send me an email at the address where you RSVP'd, annika@committeetoprotect.org. But I want to thank everyone for joining today, and thank you so much to our speakers and advocates. We appreciate your time on behalf of your patients and all the people of North Carolina's 11th Congressional District. Thank you so much, Dr. Helfman, Dr. Brown, and Dr. Pickler. We appreciate it.
Thank you.
All right, have a great day, everyone.